Very good afternoon, everyone. On behalf of Dr. KK's Heart Care Foundation of India, we come to you with another webinar. This is our 73rd webinar. We're continuing Dr. Agrawal's mission of imparting health education, of imparting every section of the society. This is something that he dreamed of, and we continue to do this week on week and bring you different sessions. I would really like to extend a warm welcome to our co-hosts for today. Thank you so much for taking our time with your busy schedules. I know everything is back to being open physically, but we are continue to we are very happy to get your support virtually so that we can take this to our audience across India. We have a huge reach on YouTube, on Facebook, on Instagram, and the entire audience from across India and the world really looks forward to these sessions. So thank you so much, ma'am, for joining us. I would like to welcome Dr. Geeta Parvanda, Principal and Dean, Pannadhai Ma Subrati Nursing College, Swami Vivekanand Subrati University, Meerut. Also, Mrs. Archana Chaudhary, Principal School of Nursing, Tirath Ram Shah Hospital, New Delhi. I would now like to invite Geeta ma'am to say a few words. Thank you for joining us, Geeta ma'am.
Jai Hind, Namaskar. Thank you so much, Professor Trustee from Heart Care Foundation, ma'am. And it's a glorious moment to extend my warm greetings to all the honorable dignitaries, guest speaker, Dr. Deepa, and all the participants of this live session on the theme, Structuring Health in this COVID-19. I extend my warm welcome to the dignitary, Madam Nana Agarwal Ahuja, who is trustee, Heart Foundation, and a founder member of the Talking Pound Communication, and Professor Archana from Tirath Ram School of Nursing, New Delhi, for organizing this session on the important theme that is structuring the health in COVID-19. I, Dr. Geeta Parvanda, working as Principal and Dean of Faculty of Nursing, Swami Vivekanand Subharati University, Meerut, welcome you all once again. And thanks the resource person, Dr. Deepa, for giving a consent on this need of our topic in spite of your busy schedule. This pandemic around the world has taught a great lesson on humanity and humility, and especially it has bring spotlight for the nursing professional as front worker. COVID-19 response strategies was critical. There is a requirement of appropriate tools and defined pathway now also, which needs policy intervention, especially the digital health tools. The good governance health system is also imperative to ensure transparencies and accountability. Without wasting any time, it's time for me to invite the guest speaker, Dr. Deepa, to share her update and valuable words on the current theme. I would like to just introduce Dr. Deepa Natarajan, who is working as a principal in Savita College of Pharmacy, Tamil Nadu. Dr. Deepa, she has obtained her post-graduation degree in pharmacy from Madras Medical College and PhD in pharmacy from Tamil Nadu MGR Medical University. Madam has obtained many awards, and Madam is really to say that she is a true academician, and she has got national 23 and international 24 scientific publication, and also having 2 patent cooperation treaty with the World Intellectual Property. This is a very great achievement as an academician. Madam has a focus of research to bridge the gap between the preclinical and the clinical trials of Siddha formulation. There are many awards, but a few awards Madam has received prestigious award. She has obtained the Best Principal Award 2020 from Institute of Scholar Bangalore. Madam has received Iconic Woman of 2022 award Medical Mission International Global Women Achiever Award on International Women's Day, March 2022. Madam has received the Research Excellence Award 2020 from Institute of Scholar, Bangalore, and awarded the highly regarded educator by American Leadership Board, USA. Without wasting any time, Madam, now this platform is yours. Dr. Deepa.
Yeah. Thank you, ma'am. Very good afternoon to one and all there. I'm so happy to be part of this today's talk show over here. It's my pleasant situation here because I know Chitra ma'am instantly when she called and asked me, our association with Mrs. Chitra is something more than decades time. So I should not, without no hesitation, I said, okay, let me just give her time for her. Okay, without no delay in my what's about the today's topic, let's move on. Shall I share the screen, ma'am?
Yes, of course.
Okay, so post-COVID, so what is the life beyond COVID? Actually, we should all be happy and we should all thank the Almighty for making us sit today with our life, because COVID has costed many people's life and many people have lost their thick and thins. And we should first grace the God's curse, God's grace on us to be alive amidst this pandemic situation. So I take this opportunity to say a humble thanks to my Almighty Shivji for making me alive today in spite of this hectic situation throughout the world. So effects of coronavirus in 2000, which started in the year 2019, it has created a lot of social and political and economical issues with the healthcare with respect to many countries. So kindly bear with me, the power will resume in a minute. Unlike Ebola and Zika virus, it is something different. It has caused many problems and it has not stopped with only one wave. We have already seen up to three waves. The last wave which we have seen is Omicron, which has gone very weak because of the tough immune system of the Indians. It becomes very clear that infectious disease should be considered among the most important health hazards that we will need to continue focus in facing the foreseeable future. Hence, this topic is something to do about structuring one's health in the post-COVID scenario. So what are the things which we can do to regain our strength after COVID-19? Taking support from a family member, say for example, once the family is tested positive and they had recovered from COVID-19, let me just mute my camera so that okay. So we have to frequently keep our health assessed because we do not know what this virus is about and what is the impact which is going to create in the human mankind after a certain period of time. Because the virus itself is an entirely new stuff where the research is not yet begun, and only after the onset of pandemic situation, many research have started on the particular topic called as coronavirus, and we have already seen the various strains of the mutant strains of the COVID-19, and this has made us to focus on research with respect to COVID viruses. So this infrastructure which India today has developed to develop an instant vaccination portfolio is really a great thing which the government of India has done, and we should thank Bharat Biotech and other companies like Dr. Reddy's and other companies who have developed brains into the development of these RNA virus vaccines. So what is the primary concern? So now that scenario of building the disease, getting into the disease and recovery from the disease is over. So now we should think what after the disease is about. So that is the real task which we are going to face for the next few years, right? And so what we have to do is we have to start. So far you have seen people working from home, people have not gone to work, people have been busy in the business, and suddenly there is a drop in business. There is a socio-economic downfall in every family, right? So in order to overcome this, it has created a lot of psychological impact both to the students as well as the grown-up community. To the grown-up community, it is only about the financial stress and the financial constraint which the family has incurred due to the loss or demise of the earning member in the family. But when it comes to students, it is creating a lot of psychosomatical stress because they are all before the screen without, this is actually new to them. They are not used to the education pattern of sitting in front of the computer to learn. So we are being forced, and we had a changeover in the modality of education from the book and pen model to the smart book, to the computer and screen model. So this is entirely a different tool which we are being forced to take it up whether we like it or not. So after this, there's going to be a post complications. What are the post complications? There was limited physical activity during the pandemic. We have to accept. So because of limited physical activity, we were all forced to sit in front of the computer to manage the daily work and daily school lessons or whatever. So in that case, definitely we would have not taken a proper diet because of the lockdown. Limited source of nutrition would also be a problem, and we should not have been taken care of ourselves in a way we were used to the regular lifestyle. So there will definitely be a physical overweight. This is a major scenario today. You see any school going or college going students in this 2 years, they have put on a lot of weight because of the sitting in front of the
Ma'am,
screen.
your slides are not changing. We can only see the first slide right now.
Okay, I'm sorry. No, I'm still in the first slide.
Okay, okay.
Okay. So we should have very basic changes in the lifestyle so that to overcome whatever nonsense we had committed for these 2 years, sitting in front of this screen and TV, we'll have to recover ourselves to another new normal lifestyle. What is new normal lifestyle? To the from the limited access of work, we are now back to the normal frame of work. So adaptability from the new normal to the actual working style is great. It will invite a lot of mental challenges, so which will be really making us very happy. So the human body also needs some stretching and other requirements to cope up the current requirement. So what is the best thing we can do every day is that, as you all know, everybody in the country would have definitely seen COVID-19. No, there is no going to be any human individual without tasting the symptoms of COVID-19. Very rare cases, somebody would not have tasted. All of us would have tasted the symptoms like cold, cough, etc. So what suggestions can be given is that to improve our lung parameters, we can start with breathing exercise. How this can be done is, we can ask the patient to sleep his front supporting the bottom and his abdomen should be placed in the floor, and he can have 30 minutes of breathing exercise, and he can sleep in the sides. He can rest himself in an elevated platform, and all these things, it will improve the lung efficiency. And alternative nostril breathing, this is called as pranayama. This invites a lot of oxygen which will be gushing into the system, which is very essential for lung revival. This is how to do pranayama, and this is called as incentive spirometry, where you blow, and this also increases the lung capacity, and it gives a very calculated, and it gives every time the highest level of oxygen will reach the system. And the balloon exercise. This looks funny, but still we can try doing it at least weekly once to improve our lung efficiency. And relax, you deserve it. It is good for you and it takes less than a time to think on it. So next to what we can do is simply work. We can change the position of sitting because long these years, for 2 years, we've been sitting only. So what you should do is slowly lift your shoulders up like this and bring it down. So this will give a kind of exercise to your upper body. And while sitting only, you make small circles, keeping your arms and small. You can do circles, keeping your hips straight and your legs. So this makes your mobility possible even when you are sitting. So this is very essential because for last 2 years we have not kept ourselves mobilized for a long time. We have been exposed only to sitting. So ankle tap. These are very small things which we can do sitting in one place. Just tap your ankle. This creates some kind of motions in your lower limbs and ankle circles. Marching on the spot. Don't go anywhere. You need not walk along the way, and you can simply stand in one place and keep marching. This is also a good exercise to make yourself fit for post after the COVID scenario. And step up. Simply have a step. If you don't have a step, simply think that there is a step and jump. And bicep curl, no need to have the weights in your hand. Simply you just lift your hands like this. It will give a upper body movements. And wall push. Wall push-up can be done, which will expand your lungs. This is very essential. You need not go to the gym and all. Simply at home, what are the best possible, we can do it. Arm raise, yes, simply like raising your hands and putting it down 20 times for 3 cycles can be best enough for the lung to get recovered. And sitting and standing, simply raise from the chair and sit for 20 times a day. This will recover your posture correction. And heel raise. And this is very essential. I tell you, the calf muscles, all of us, we don't consider calf. There is a muscle called as calf muscles. Only when it pains, we are thinking about the calf muscles. But simply holding a chair, you just raise your heels and put it down for 20 times, 3 sets a day. If you see the difference, your calf muscles will feel so relaxed. And muscle stretches, simply while sitting, once you can stretch your muscles like this, simply turning your head upside down. And this is all little difficult, but you can try. And coming to the diet portion of the post-COVID scenario, eat energy-rich food. Foods is a source of carbohydrate, and there is now many people, if you have seen, there is a spike in glucose level after the COVID scenario for all the diabetic population. So what can be done is that you can correct the diet pattern in such a way that your carbohydrate content is reduced to a minimum of 75 grams per day. So if you consume more than 75 grams per day, definitely you're increasing carbohydrate intake beyond your daily requirement. The daily requirement of carbohydrate intake is sufficient from 75 to 80 grams for any individual, right? So the source of carbohydrate would be from wheat, rice, maize, and oil, fats and sugars and protein. But major source will be wheat, rice, and maize. Bodybuilding foods like meat, eggs, poultry, milk and milk products, all should be supplemented in your diet to supplement with calcium and vitamin D. Because as you all know, during the pandemic, we had very limited access to the sun because we have not moved ourselves from the inside of the house to outside. So we are not exposed to sun. So when you are not exposed to sun, you don't have vitamin D. So you should take food in such a way that vitamin D is at least available from the food which we consume. So productive foods like which will strengthen the immunity. So try matching up enhancing your immunity because after COVID-19, definitely immunity would have been compromised. So you have to recover your immunity to a stronger level by consuming immunity-rich foods like dark leafy vegetables, yellow and orange colored citrus fruits, which contains vitamin A, E, C, and other minerals like zinc, copper, iron, and selenium. And do not forget our ancestral way of handling immunity. Drink a lot of herbal tea or concoction made out of tulsi, darchini, cinnamon, kali mirch, etc. Somebody started sharing again. Somebody is sharing the screen.
Yes, ma'am.
My screen is seen.
It is visible, madam. You can go on.
It's not going for me.
Ma'am, I share screen.
Okay. Fine. So drink warm, always drink only normal water and do not drink water directly from the refrigerator at least for a couple of months. And add ginger and garlic to your regular cooking and keep yourself well hydrated. Keep talk. Do not strain your voice because, as you know, COVID would have also paralyzed your vocal cords and other pharynx and larynx area. So try to communicate. And when you find any strain in the throat, do not forget to sip a glass of water. Managing problems with attention, memory, and thinking clearly, because I've seen many patients reporting that they are forgetting many things. They are not able to remember small things. So they are getting weaker, breathless, and fatigued. So train the brain with new hobbies, activities such as puzzles, word training, number games, memory, etc. I'm sorry. And this is the thing. So we can breathlessness can be scaled at nothing at all as 0 and 0.5 as very, very light and 1 is very light and all these things. You can have a score up to 10 to diagnose it. What is plasma therapy, which is not required right now because we don't. People who have recovered from COVID can donate their plasma for treatment. So apart from this, I would like to add few things. COVID, as such, after the COVID situation, all the working professionals are busy on their legs to regain the working model which we were following before COVID. So, what can be done to take care of ourselves is that morning, have a routine. However busy you are, have a routine to have a fresh, free, carbon monoxide free oxygen early in the morning. So everybody has to adopt a lifestyle of getting up early in the morning. Say, for example, 5 o'clock. 5 o'clock is a nice time to get because you get unpolluted air which is rich in oxygen. So that is very, very essential for us to recover our damaged cells in the system. So this is point number 1. Point number 2 is add ginger and garlic in your regular diet portfolio, where ginger will help you enhance your immunity and garlic will maintain your cardiac health. So COVID-19 vaccines which we have all taken is set to produce thrombosis inside our system. So take foods which can prevent thrombosis. That is also essential. So if you have any symptoms of dizziness, weakness, breathlessness, or chest pain, kindly immediately address to the physician of your family and get it noticed at the first sight. So what normally we think is it is just a pain, just a small thing, we will go later. So because unexplained incidents of deaths are happening because of this ignorance. So COVID, we do not know what it causes in the after end. So be vigilant in taking care of yourself after the difficult times. During the difficult times, taking care of us is different from the taking care of us after the difficult times. And people who are diabetic, please take care and have a watch on what you eat and check your fasting and postprandial levels at regular intervals to avoid complications. And few of my friends who are in who are ophthalmologists have also documented that there is an incidence of diabetic retinopathy in post-COVID recovered patients if after the COVID-19 implications. So kindly do have a ophthalmic examination if you are diabetic and if you are affected by COVID once during any of these 3 waves which we have faced. And apart from this, always for a normal human being, do not neglect any first sign of inconvenience which the body presents, because we do not know what COVID is going to show you on the cards for the future. So stay vigilant until we are completely analyzing and we are completely educated what coronavirus is about. And also be prepared to face any more challenges which nature has got to give us. Please treat nature as your friend and treat it with patience and treat it with love so that it does not bounce back on us, creating a lot of health issues like this and putting us in unpleasant situations like COVID-19. And I thank Mrs. Chitra for offering me this wonderful opportunity to be with you for this evening. Thank you. Any questions? I would be happy to answer.
I'm just taking some of the questions from the chat box. Anyone has any questions, please raise your hands or kind of.
So I'm comfortable texting in chat box. I can text.
Yeah. Otherwise, anyone has any questions, you can ask on screen. I ask my co-hosts if they have any questions. Archana ma'am, do you have any questions?
No, I have no questions.
What do you think about the talk, ma'am? What are the...
Yes, I have noted down few points. Dr. Deepa, thank you so much for taking this session and be a guest for us. And I also would like to thank my co-host, Dr. Geeta. I have noted few points in your talk. Like you explained us about the post-COVID precaution. क्या हम कोविड होने के बाद अपना ख्याल कैसे रखें? तो इन्होंने कुछ पॉइंट्स बहुत अच्छे से एक्सप्लेन किए हैं, जैसे कि एक्सरसाइज इन्होंने हाईलाइट किया, क्योंकि हम लोग कोविड टाइम में मोस्ट ऑफ द टाइम ऐसे बैठे हुए हैं, स्टूडेंट्स घर में बैठे हैं, ऑनलाइन क्लासेस चल रही हैं, वर्क फ्रॉम होम चल रहा है, तो उसमें एक्सरसाइज की इंपॉर्टेंस बहुत ज्यादा बन जाती है. तो इन्होंने जैसे बताया हम बैठे बैठे एक्सरसाइज कर सकते हैं, मॉर्निंग वॉक कर सकते हैं, अपनी लाइफस्टाइल को थोड़ा मॉडिफाई करना बहुत जरूरी है इस मोमेंट पे, जैसे कि अपनी इम्यूनिटी पे ध्यान देना, अच्छा खाना खाना, हाइड्रेशन लेवल, पानी का इंटेक ज्यादा रखना है. अपनी इसमें क्या होता है कि कोविड में हमारा चेस्ट इन्फेक्शन है, थ्रोट इन्फेक्शन है, जैसे मैम ने कहा कि अपना बहुत ज्यादा अननेसेसरी नहीं बोलना है, अपनी वॉइस को मॉड्यूलेट करना है, कंट्रोल करना है. मेमोरी गेम्स खेल सकते हैं स्टूडेंट्स, जैसे उन्होंने बताया, क्योंकि ब्रेन को भी एक्टिव रखना बहुत जरूरी है, बिकॉज इन दिस टाइम स्टूडेंट्स ऑल द टाइम यूजिंग मोबाइल फोन्स एंड लैपटॉप्स एंड कंप्यूटर्स. सो दे आर बेसिकली, पहले हम लोग जो बाहर खेल के टाइम स्पेंड करते थे, अब वो नहीं हो रहा है. अभी स्टूडेंट्स बैठ के सिर्फ मोबाइल पे चैटिंग्स कर रहे हैं और जो है वो माइंड एकदम से वो एक वर्चुअल वर्ल्ड में जा रहे हैं. तो पोस्ट कोविड इसको और भी इफेक्ट पड़ रहा है. फिर दूसरा है काउंसलिंग, क्योंकि कोविड के टाइम पे लोगों की जॉब्स गई हैं, अब किसी को कोविड हुआ है तो वैसे भी घर में आइसोलेट हो जाते हैं, तो जॉब्स जाती हैं, फैमिली में इनकम सोर्स का प्रॉब्लम होता है, तो एक फैमिली थेरेपी और काउंसलिंग का भी इससे बहुत बड़ा रोल है, क्योंकि पोस्ट कोविड सिर्फ फिजिकल इम्पैक्ट नहीं पड़ रहा है, हमारा मेंटल और सोशल इम्पैक्ट भी बहुत पड़ रहा है. So we should focus on the counseling and family therapy more. Lifestyle changes is very important. And as ma'am said that ginger and garlic, few things she explained us very nicely. अगर कोई भी symptoms है तो we have to be vigilant. We have to report the physician on time. अगर किसी को भी कोई भी comorbidity है like hypertension, diabetes, तो कोई भी अगर immunosuppressant problem है, उनको पहले से कैंसर है, तो they have to be more careful. उनको रेगुलर चेकअप्स के लिए जाना और उन चीजों को एक लिमिट में रखना, ग्लूकोज लेवल को लिमिट पे रखना, हाइपरटेंसिव है तो अपना बीपी कंट्रोल रखना, अगर ऑप्थेल्मिक एग्जामिनेशन करवाना, तो ये सारी चीजें हैं जो पोस्ट कोविड हमें ध्यान रखनी चाहिए और अपना ख्याल रखना चाहिए। सो मेंटल, फिजिकल एंड सोशल तीनों इम्पैक्ट पे, अगर तीनों ही एरिया में अगर हम मिलके फोकस करेंगे तभी हम इससे बाहर आ पाएंगे, कोप अप हो पाएंगे। प्लस पॉजिटिव एटीट्यूड इज वेरी इंपॉर्टेंट। अगर हम अपने आप को सोचेंगे कि ओह मुझे कोविड हो गया, मैं बीमार हूँ, मैं घर पे हूँ, मैं सैड हूँ, तो इसमें फैमिली जो है, फ्रेंड्स सर्कल, फैमिली सपोर्टिव होना बहुत जरूरी है। तो इससे हमें सबको मिलके चलना पड़ेगा। सो दैट्स माय ओपिनियन अबाउट दिस, एंड थैंक यू डॉक्टर नैना अग्रवाल, मिसेस नैना अग्रवाल आहूजा. I really appreciate your gesture that you are, matlab you are carry forward this initiative by Dr. K.K. Agarwal, and we are very lucky that you are giving us opportunity many times, and our students are very lucky to have your sessions. Thank you so much arranging for this session.
Thank you so much.
Madam, may I, ma'am, Dr. Deepa, just one question from student. They just want to ask, like COVID-19 was now like very frequently seen in children. So any food restriction or any sort of some special diet can be advised, or some module can be there which can be given as a therapeutic diet in order to just prevent the further episode or further like this type of pandemic.
Okay. Ma'am, you have asked the right question to the right person. I'm a consultant dietitian. What can be given for children after
Okay.
COVID is a big question by all mothers. So I would suggest, as I rightly pointed out, children have gone very obese, right? So it is better
Yes.
to reduce the carbohydrate intake of the children, limiting to 50 grams per day. 50 grams per day is only a bowl of rice.
Okay.
So children are very difficult to get controlled with one bowl of rice. Instead, what we can do is simply you can replace the breakfast with two eggs.
Okay.
Either boiled or as omelette, whatever way you wanted to have. So replace the breakfast with eggs. Afternoon they can have regular meals, and night substitute with whichever is colorful. Whatever fruits they like, you can substitute with the fruits. Do not give only rice related items or wheat related items for all the 3 times until at least for 6 months, to bring down the added weight which they have added to their body during this last 2 years. So by doing this, there will be gradual weight loss, and there will be correction of metabolism, and there will be vitality improvement in terms of mineral and vitamin loss, which will make them completely immune by end of 6 months.
Very nice. And one more small question is there, that is personally from my side.
Yes,
Since you are from the pharmaceutical branch, like now a concept of herbal garden, like it has come like after COVID only, I have seen this initiative has been taken. Now what type of plants and all we can just make it as an antitoxic and all can be initiated with the health professional, I can say. Like only we were knowing about neem. Yes, yes, ma'am.
You wanted to grow these things in your home?
It can be at the institutional level also. There is.
Yes, then you can have Karpura leaves, plants, and then you can have cinnamon, small strips, small trees you can try. You can have basil.
Okay.
And you can have tulsi itself. You have varieties of tulsi, white and the black ones. You can have betel, you can grow ginger, you can grow garlic, you can grow pepper.
Okay.
So all these are you can try at home itself. Even in a small pot it grows.
Thank you so much. Thank you so much. Over to Mrs. Yes.
One more question from Mr. Pankaj. He's asking, ma'am, I took the vaccine and then I've seen a lot of side effects coming up. So are there any way of, lifestyle or diet?
Can I know the side effects which he is going through?
That he's just saying it's a question that's come on Facebook, so he hasn't specified. He's listening to you on Facebook. If we get a response, we'll tell you. But overall,
yes, ma'am, that is what I was telling. See, post-COVID, there are a lot of implications which we might not notice. We may think it is simple pain in the leg. It is not a simple pain. It may be DVT. It may be a deep vein thrombosis because of the vaccine, because of the internal thrombosis which is going to happen in the minute blood vessels. So that is why I said stay alert and get it checked.
Yeah. What about generally after someone's had COVID? What are the things they should keep in mind to?
That's what, ma'am. We should keep ourselves mobilized at least an hour. Every hour you should walk.
Yeah.
That we don't do at all.
Yeah.
And replace the normal water. Don't drink refrigerated water. Replace the water, normal water. If you like the adjuvant, replace the normal water with adjuvant water. That is even still better.
Yes. That's very helpful advice. I think that answers the question, and these are the questions that we've got. Thank you so much, Deepa ma'am. I know you have
Thank you, ma'am.
also. Thank you so much for joining us. It's been an absolute pleasure. We look forward to hosting you again, maybe sometime in the future on one of our sessions.
Sure, ma'am. Would be my pleasure.
Audience who's taken out time on a Friday afternoon to join us. Thank you to my co-hosts, Geeta ma'am, Archana ma'am. Thank you so much for joining us, and thank you Sapna for organizing this, and Chitra ma'am. Truly appreciate it. We will be back next week with new sessions. Have a great weekend, and thank you so much.